Good morning. How are you all? Very good. How are you, Lane? That's good. I am acting, yeah. Not just this week. You're all set? So we're very pleased to report that we have no new locally acquired cases of COVID-19 in Queensland, a fantastic result. We have 2 overseas acquired cases that were detected in hotel quarantine. That follows a weekend where we also had no new locally acquired cases and 2 cases in hotel quarantine amongst returned travellers, 1 each day, Saturday and Sunday. That means that right now we have 36 active cases in Queensland, 1,756 total cases throughout the pandemic. We did 7,393 tests in the past 24 hours, and it looks like we're on track to pass 2 million vaccinations sometime this week, which is great news also. The Deputy Commissioner will outline for you in a moment the outcomes of a joint operation to ensure compliance within the heavy vehicle industry. Keeping our freight moving has been critical to our economy and to our livelihoods throughout this pandemic, but it appears as though the compliance with the arrangements that were put in place to allow freight to continue, that compliance with that has lapsed somewhat. So the police, working with the Heavy Vehicle Regulator and the Trucking Association and the Department of Transport and Main Roads, has been intercepting vehicles coming from other states, particularly those states where we have hotspots, Victoria and New South Wales. And unfortunately, many of the trucks that they intercepted, the drivers had no appropriate passes, hadn't been recently tested. Some had even travelled from those hotspots. And so we have a message to drivers in that industry, but also employers in that industry, in freight and logistics, and also the big companies that rely on them. It is absolutely critical that for us to allow freight to continue to move across the borders, we need you to increase compliance with the advice that has been provided, and Dr. Young might outline some steps under consideration for strengthening those requirements. But it's absolutely critical for all of us that we improve compliance in that industry, particularly given that that appears to have been the vector by which the Sydney outbreak has reached Melbourne. Of course, this week is a very, very exciting week for Queensland. You've heard from the Premier already today. She's on the ground in Tokyo with the Lord Mayor and with a minister representing the Prime Minister. And we all hope, I'm sure we all hope, that they will bring home the 2032 Olympic Games for Queensland. This is a really big deal. 91,600 jobs, an estimated $8.1 billion injection into the state's economy, as well as the alignment that comes from all 3 levels of government working together towards the same objective for 11 years. I'm sure all of us remember how Expo changed this city and how it changed our state, and the Olympics is an opportunity to do just that. So it's a fantastic and very, very exciting week for Queensland. Thank you.
Thank you, Acting Premier. So no new community-acquired cases in Queensland, and I just want to thank those 2 families that have been involved in those 2 most recent clusters. They're both Delta variants. We know how contagious they are, but due to the really good work done by both of those families, we've not seen any spread at this stage. It's really important that people we have asked to go into quarantine, there's 942 in home quarantine today. It's really important that those people remain in quarantine for their full 14 days and get tested before they exit quarantine, so we can do our absolute best to not have either of those 2 clusters of Delta variant spread through our state. And then you've just heard from the Acting Premier about some work we're doing with the freight industry. The freight industry have worked very, very carefully with us right from the start of the pandemic, and we had in place a requirement for all freight drivers to be tested every 7 days. Now, I can understand why that lapsed when there weren't any cases anywhere in Australia, but it's important that requirement is immediately back in place so that any freight driver who arrives in Queensland from any declared hotspot, which today is all of Victoria and Greater Sydney, extended Greater Sydney, has had a test done in the 7 days prior to them entering. And I've also asked, and we'll be working this through with the freight industry, now that New South Wales has put in a requirement that anyone leaving one of those three most concerning LGAs, so Canterbury, Bankstown, Liverpool or Fairfield, must be tested every 3 days. So I will be working with the freight industry to ask them to put in a process that anyone who's been in any of those three LGAs in the previous 14 days, that they give evidence of a negative test result prior to crossing the border into Queensland. We need to do that. It's vital that freight continues. We need freight, of course we do. All the goods that are moved, including our most precious vaccines, we need to have freight to be able to cross into Queensland, but we need it to be done safely. And I know that the freight industry will work with us again to ensure that they do keep Queenslanders safe as we go forward. Now, it is really important. You would have seen that there were 1 million additional doses of Pfizer vaccine came into Australia for this week. It's great to see those increased doses. Now, it is very, very important that any Queenslander 60 years of age or older goes and sees their GP or a pharmacy if their pharmacy is providing AstraZeneca in their area, or one of the Commonwealth clinics, and gets vaccinated with their first dose of AstraZeneca. And anyone who's already had one dose of AstraZeneca, it doesn't matter what age you are, then to come forward and at 12 weeks get the second dose. I'll be doing that on the 31st of August. I had my first AstraZeneca dose and my second dose is due on the 31st of August. Now, anyone under that age, please keep an eye out for when there are increased stocks of Pfizer. At the moment, unfortunately, we only have enough Pfizer to provide second doses and for those critical frontline workers. So it's really important they keep coming forward, particularly our health and emergency services and aged care and disability care workers. It's important they keep coming forward and getting their first and their second dose of Pfizer. For other people, unfortunately, we just need to wait till we get some more supplies from those additional doses that are coming into Australia. Thank you.
It's great that for a number of days now we've seen no additional local community cases. I want to thank the many people who have been in home quarantine over the last couple of weeks, and of course we have almost 1,000 people still having to isolate in home quarantine currently. So we thank them for doing the right thing and keeping us safe, which means that we can keep everybody safe. The speculation around the borders, can I just clarify? Once again, there is no proposed change for the New South Wales border. Victoria has been declared a hotspot for the whole of the state because their state has declared themselves into a lockdown, and also because they have community transmission happening right throughout the regions of Victoria. And I've seen overnight reports that South Australia will be changing their border bubble because there are a confirmed case close to the border of South Australia. It is important for everyone to realise that so far there has been no transmission outside of the local government areas that we have declared a hotspot in New South Wales. No community transmission. There has been some positive cases that have travelled outside of those LGAs, but they have not transmitted to anyone else in those communities. Also, there has been no positive sewage results outside of the local government hotspots that we have declared for New South Wales. So those are two critical factors. No positive sewage means there's no evidence of positive cases in those regions, and no community transmission means that the risk at this stage is contained within the LGAs that we have already identified. This is important because we know that putting in place a physical hard border on the New South Wales-Queensland border is very logistically difficult, but also impacts significantly on those border towns. We will only do this if we absolutely have to, and we'll take the advice of Dr. Young in doing that. But at this stage, although we are seeing new cases every single day in the community in New South Wales, all of those new cases are being contained within those LGAs and not transmitted outside of that. So we will monitor this every single day, but at this stage we are able to keep the restrictions as we have currently. Of course, our current restrictions, the mask wearing, the density as far as cafes and restaurants and venues, all of those changes that were put in place for our 11 local government areas in South East Queensland will remain till 6 a.m. this Friday, and each day we will monitor our results, but we're very pleased with what we're seeing so far. And as you've heard from the Acting Premier today, after we became aware of transmission from New South Wales into Victoria with those removalists travelling interstate, we asked the Queensland Police Service to do further auditing and checks of the freight industry and transport industry. This is really important to keep our economy going, but we also need the sector to do the right thing so that we can all stay safe.
So, good morning, and just a quick reminder to everyone, masks, we still need to wear those. So since we've started the current restrictions, we've handed out 1,890 and 30 in the past day. So that tells you there's still a lot of people in our community not taking their masks with them. Please do so. Yesterday at our road borders, 1,690 vehicles intercepted, 10 turned around and 2 placed into quarantine. I'll get to the heavy vehicle stuff shortly, but I'll give you the overall figures. At our domestic air borders, 833 persons processed, 2 refused entry and 64 into quarantine, and we had 113 international arrivals. Now, as you heard, we've put together an operation over the weekend in partnership with the Department of Transport and Main Roads, and can I also acknowledge the very, very, very good support from the Queensland Trucking Association and the National Heavy Vehicle Regulator in us undertaking this operation. The focus was to make sure that we can have confidence that our current border posture is appropriate in the current risk environment. So I'm just going to give you some figures first, and then I'll come to explaining what they mean. So during the period that I have the reporting for, 226 heavy vehicles were intercepted. We found that 83 of them did not have the appropriate border passes. Now that can include either a travel declaration pass, or if they were out of a hotspot, a border declaration pass, depending on where they have originated from. So in that examination of those figures, we found that 29 had come out of a hotspot without the appropriate pass. We were obliged to take enforcement action into a number of them. So 7 penalty infringement notices have been issued in relation to COVID breaches, and a further 13 traffic infringement notices for a variety of traffic offences, including speeding and fatigue management. What's disappointing about this is that once we've done our risk assessment of all these people, the risk was reasonably low. Only 1 person has been placed into hotel quarantine. That particular driver had completely falsified records, was not cooperative with our investigation, and in fact had come out of a hotspot and had stopped at the Chindera truck stop. So that person was placed into hotel quarantine. 1 or 2 others, and I'm waiting for a final collation of these figures, were refused entry and had to go out. All the others, it was a matter of working through with them and making sure that they had the appropriate pass, because they did have an exemption under the CHO's direction, so we were able to work it through with them. Nonetheless, those that blatantly do the wrong thing can expect enforcement action to be taken. Our initial approach was one of education and monitoring. That was changed over the weekend to one of engagement and enforcement, and that will continue. That's one of the points I want to make. This operation will continue for the foreseeable future until we can get the compliance we need out of this particular sector. I should also say that the onus is on the operator, the driver. So the way the directions work is that people crossing the borders, and that doesn't matter whether you're a truck driver or a normal member of the public, you must understand what your obligations are crossing our border coming into this state. people need to have in place the appropriate passes if they're coming out of the hotspot, a border declarations pass, or New South Wales for that matter, or otherwise a travel declaration pass. They are very important for contact tracing and very important for us being able to manage this risk. As I said, we'll continue to do this for some time. It is disappointing. Those people have been irresponsible. It is a simple thing to get these passes. The regime for freight, an F-pass, has been in place for some time now, and they should understand their obligations. Thank you. No, my understanding, no one has tested positive, but I haven't got the outcome of the investigation as yet. Thank you. The 29 primarily have been out of the Sydney hostel. Look, it is really disappointing because, as I said, we go to the effort of assessing the risk to us before we make a decision around whether they can come in or not, because they can get the exemptions. There's a regime in place for them to get the exemptions. And I think it was mentioned around the testing as well, which is a recommended posture that they should be getting tested, and the compliance with that was pretty low as well. So as you've heard from the Chief Health Officer, we'll be looking at that more closely, see what we can do on that.
Did they get turned around, or what happened?
No, as I said, they actually have an exemption. What they've got to have is the right paperwork. So once we're able to get that filled out with them and verify their bona fides and that they do have an exempt purpose to come in, of course they can come in. We need to keep supply going. We need to keep the freight industry going.
And the driver who went to the Chindra truck stop, was he out sick?
Yeah, he's gone into hotel quarantine. Yeah, that's the truck stop. Thank you.
I don't have that specific information. We can get that for you. Yes. Not at this point, and I'm becoming less concerned because they're tested negative while they were there, and now we'll test them again in a few days, and then if they're negative again, there's no risk to Hamilton Island. Visited Coffs Harbour, yes. Well, the Chindra one is only 13 k's from the border, so yes, it is getting close to us, but there hasn't been local transmission. So cases have visited, and then New South Wales Health lets us know that there's been positive cases, and they test all of the contacts and let us know if there are any contacts.
A lot of Queenslanders plan to go down to New South Wales for the ski season. What's your advice for those people?
Oh, my advice has been very clear for quite a while now. No one should be travelling to anywhere in New South Wales or Victoria unless they really and truly have no other alternative. Now, we know some people across the border live across both states, and that's understandable, but people should definitely not be going into New South Wales for a holiday. This is not the time to do it. It will continue until there is no local transmission in New South Wales. Yeah. We have 2 people in ICU, one is ventilated and one isn't. And we can get the specifics. I'm sorry, I don't have those specifics. As I said before, very happy to go and get them. I just don't have them on me. No. If they've been in one of those 3 LGAs nominated by New South Wales, they will need to have a test done within the previous 3 days of arriving at the border in Queensland and a negative result. Right, that's for those 3 LGAs. For any other truck driver who's been in a hotspot within the previous 14 days, they need to do surveillance testing, which means every 7 days they need to do a test. Unless, if they're sick, of course, they have to isolate like anyone else would be, but as it's surveillance testing, they just need to do it every 7 days and provide evidence that they've done a test. They don't need to stop driving while they wait for the result. Otherwise, you can imagine across the whole country there would be problems with moving freight.
Sure.
The Commonwealth has said that they won't change the law in relation to telehealth being
Those two decisions are quite disappointing. They were the two mechanisms by which the Commonwealth could ensure that all Queenslanders had equal access to voluntary assisted dying should it pass the Queensland Parliament. What other states have done, Victoria in particular, is issue guidance to health professionals about what their legal advice says they can and can't do via telecommunication service. And while this is a way down the track, I imagine that that is the approach that we would take here until such time as those laws are amended. But let's remember what this decision from the Commonwealth means. It means that people in rural, remote and regional parts of the state that have less access to more highly trained doctors may not be able to access the same level of services that people in the cities can.
And as a state, had any assurances from the federal opposition that comes into government whether or not it will change the laws on this?
I'm not aware of assurances. I've certainly had discussions. I might just check whether the Health Minister... No, so we haven't discussed it with them, but I have discussed it with them, but we don't have an assurance from them. We'll continue to have those discussions. But the best assurance that the Commonwealth could do, you've got to remember, the Morrison government represents just about every part of the state that we're talking about here. It would be better if they put the interests and the equity of access of those constituents ahead of whatever politics is causing them to make that decision. I don't. All I know about that matter is what was in the estimates hearing.
Do you find it alarming that she should be referred?
Well, the nature of these things is often the person being referred doesn't. That's that's what made the line of questioning from the opposition that day so bizarre.
Just on the nurse in Victoria who's trying to get home, she's really upset that her father's funeral after he died in the car crash. Any change on that? Will she be granted exemptions to go to that funeral and bypass quarantine?
Yeah, look, obviously these circumstances are very tragic, and we've dealt with many of these throughout the pandemic, and I can assure Queenslanders that Dr Young and her team deal with these requests with as much compassion as they can, while also ensuring the safety of Queenslanders. We generally try to avoid going into the personal details, but given much of this has now been in the media, I understand that she has been granted an exemption to travel to Queensland, where she will go into hotel quarantine. She's expected to arrive this afternoon.
Just on the Olympics, is there anything that could derail Queensland's chances on Wednesday?
Well, we don't want to take anything for granted, and that's why we are doing everything that we can to convince all of those member countries that Queensland, Brisbane, the southeast will do a fantastic job of the 2032 Olympics. We can't wait to get the chance to welcome the world here and show them our beautiful city, our beautiful region, and have them stay a while and see the rest of the state. All three levels of government working really closely together this week in Tokyo to secure the Games. It's very, very exciting for Queensland.
And have you spoken to Annastacia Palaszczuk since she landed?
She's been in touch with the office. I haven't spoken to her myself. We were texting yesterday, so we'll be in constant contact during the week as we do everything we can to land the the Olympic Games for Queensland.
Just on the AFL, does it worry you that we're seeing more players and staff classified as Tier 1 and 2?
Look, obviously that escalates the risk, and Dr Young and her team are working very closely with the AFL. The AFL are cooperating very, very strongly. They understand how important it is for them to be able to move their games around and keep their season going. So, look, obviously the greater the risk, the greater the concern, and the more work that needs to be done to keep the competition going, keep other players safe, keep the community safe.
Dr. Young, can I ask you about the AFL and also about the nurse in Victoria, perhaps the AFL first and then the nurse?
Of course.
So, yeah, what's changed with...
Well, not a lot really, because I require anyone coming from a hotspot to go into formal quarantine. So these players are already in quarantine, so now they just won't be able to mingle with the other players. But all of those players are in quarantine, so there is no risk at all to any Queenslander. The risk, of course, is to the game continuing, but that's a decision, of course, for the AFL. and then the nurse.
The nurse, yeah, what's
Yes.
happening
Oh, this is just tragic. To lose your father so suddenly is just absolutely awful. So yes, of course we've given her an exemption to come into Queensland, and I do understand she's coming later today and she'll go into hotel quarantine. And then we've spoken to her that if her brother's, who is currently stable, were he to deteriorate, then we would work with her to be able to see him.
Dr. You mentioned earlier for younger Queenslanders to keep an eye on extra doses of Pfizer
Yes.
vaccine. Do you expect any more?
Well, yes, we'll get our share of that 1 million doses that's come in this week, but that's still not enough to broaden the number of people we can vaccinate. We still can only do those key groups, the people needing a second dose and our frontline workers. They're absolutely essential. And then once we do get a little bit more coming into the system, we'll be able to go back and do that 40 to 59 year age group. Thank you.